Stress Management Utilizing Music Therapy by Kayla Cafferty. Music therapy is a technique in which a skilled music therapist uses components of music like sound, beat, and balance as part of a treatment plan. This technique is typically used in a larger treatment plan that includes other medical interventions like medication. Music therapy can be used clinically to help with pain control, anxiety, communication, and treatment of other complex health conditions such as dementia, Parkinson's, autism, etc. Music therapists evaluate your progress and communicate with your healthcare provider to coordinate ongoing treatment and care planning. The length of each session and number of sessions you need depend on your individualized plan and goals. Music therapy is performed and led by a qualified professional. The trained music therapist must evaluate the patient and come up with an individualized plan that meets the necessity and skill set of the patient. Music therapy may include singing, writing lyrics, or playing instruments. Some sessions, patients will listen and then discuss the significance of the lyrics. This technique may be utilized and performed in various inpatient and outpatient settings such as hospitals, outpatient clinics, schools, nursing homes, treatment facilities for substance abuse, and even correctional institutions like prisons and jails. These sessions can be performed on inpatient or outpatient needs. Time and location may vary depending on a patient's needs and condition. During a session, the following listed above may take place. Music therapy in conjunction with other clinical interventions has shown to be beneficial in treatment of multiple health stressors and conditions such as those listed on the slide. Stress therapy can be very beneficial to the development of young adolescent and children's learnings, behavior, and emotions. This technique of therapy has been shown to be beneficial in healing and calming. The effectiveness of musical therapy can differ based on your medical diagnosis and your symptoms. A music therapist should explain and discuss these expectations and results after doing their clinical assessment and evaluation. In general, research has shown that music therapy has potential benefits in relaxation, exploration of emotions, and decrease in depression and anxiety, improvement in mood, communication, self-confidence, and numerous other vast improvements in quality of life. Research has found a distinguishment in its reduction of levels of psychological stress and increase in coping skills, along with higher levels of perceived relaxation after listening to music, especially when performed in stressful situations. More research on music and anxiety has shown that listening to music can activate areas of the brain linked to experiences of intense emotions. Music may balance the levels of anxiety that are brought on by experiences of a stress or stressor. Research found that listening to music has significant improvements with lowering anxiety. I personally work with a couple music therapists in a shared office space. Seeing and hearing all the different techniques they use in helping patients and families make me more inclined to use this technique. I already turn to music and driving as my stress coping mechanism. However, listening to music alone isn't what this therapy is about. You must work with a skilled music therapist and be evaluated to have the right therapeutic plan to receive the full benefits of this intervention. I think if I was ever in a position where I needed medical intervention, I would definitely turn to music therapy. Thank you for listening.